Okay, so today we're going to talk about OHI. My patient today is a 45-year-old woman and she brushes using a manual toothbrush 2 times a day. She does not floss regularly, possibly only once or twice a week. She also doesn't use a mouth rinse at this time. She let me know that she only brushes for 30 seconds because she brushes really hard, so she feels like that gets all of the biofilm off since she's brushing harder. Her toothbrush bristles at home are extremely flared and worn out. The patient also expressed that her teeth feel extremely sensitive, and then upon my examination, I saw that the patient had visible abrasion on her posterior buccal surfaces, on the maxilla and mandible, in addition to gingival recession from brushing so hard. The patient also has quite a few areas that have open contacts, where she reports food gets lodged in the space and then causes gingival irritation. The patient also is a type 1 diabetic, and she said that her A1C is an 8.5, but she frequently finds that due to her diabetes, she experiences dry mouth frequently, in addition to gingivitis. For this patient, I would recommend the modified Bass method and the modified Stillman method for the areas of gingival recession and abrasion. I would also recommend that they use the fingertip grasp, either between your thumb and your pointer, or just your thumb, pointer, and middle finger, as opposed to holding the toothbrush like this, because this can promote very hard brushing, whereas this, it's a little bit easier to brush with. The patient, I would also let them know to brush for 2 minutes, but again, using that method in order to avoid gingival tissue trauma and hard tissue trauma. For the toothpaste, I would recommend one that has low abrasiveness for the areas of recession and abrasion. One that has antimicrobial agent since the patient is experiencing gingivitis due to their diabetes. Also a desensitizing agent in the toothpaste for the areas where there's abrasion. And then I would also recommend that the toothpaste should have an anti-caries agent or one that stimulates saliva production, since the patient suffers from the dry mouth. Lastly, I would recommend a xylitol mouth rinse or fluoride mouth rinse, such as Spry Xylitol Oral Mouth Rinse. So I would use the show tell do method and use a hand mirror so that the patient could then see what they're actually doing and see what I'm doing. So for the modified Bass technique or the circular method, the filaments of the toothbrush are directed apically at a 45-degree angle to the long axis of the tooth. The patient should use gentle yet firm vibratory strokes in the cervical area so that the filaments can enter the sulcus and clean subgingivally. So you would brush at the gum line and then you would swoop towards the occlusal surfaces. Also, you want to make sure that you do clean the occlusal surfaces. So you should use firm pressure so that you can get into the pits and fissures of those teeth. And then for the, so you would do on the facial and lingual surfaces, the brush should stay parallel. Same thing with the occlusal surfaces. Facial surfaces on the anterior can still stay parallel. And you're brushing and sweeping. But then when you come to the lingual surfaces of the anterior, you may have to turn the brush more towards the long axis of the tooth, so it should be vertical. And again, you're circling, sweeping, because it may be a little awkward to have the brush like this, or may be hard for the patient. And then for the Stillman method, the filaments are placed similarly how they are for the modified Bass, but you are placing the toothbrush a little bit more on the gingiva as opposed to all on the tooth. So it's about still at a 45-degree angle. Some of the filaments are cervical on the tooth, and then they're partly on the gingiva. The patient should use a short back and forth vibratory stroke with light pressure. And again, you're circling, and this helps to stimulate the gingiva in the areas of recession and gingivitis. So again, you're circling and brushing and sweeping down, circling, brushing, sweeping down, circling and brushing and sweeping down. So some follow-up questions that I would ask this patient to ensure that they can follow through all of this is, what concerns do you have regarding these oral hygiene home practices? How can I help you implement these practices at home? Which of these areas do you feel you can implement immediately that they could just work into their schedule the next day and start? And which area do you feel you may need additional support in with following through at home? So those are the follow-up questions I would ask them in order to help them follow through with their new oral hygiene practices at home. And that's it.